Many clients don't realize that they are the boss of their own therapy. Know the red flags to watch for and what a good therapist should be doing ethically if they're really doing a good job. Hi, my name is Shara and I'm a mental health counselor. I've been working with clients for over 15 years and I absolutely love it. And I'm here to share with you in today's video what therapists are supposed to do ethically to walk the line and not overstep their boundaries. And also what your rights are in therapy. Now, this is video 5 of a 6-part series of how to succeed in therapy. These are things I didn't know when I was a young client, and I wish I did. So I hope this is helpful to you as you engage in your own therapy. Now, therapists are professionals. They adhere to something called an ethical code. When they are licensed, they swear to abide by a code of ethics. And what exactly is ethics? Well, ethics is, if you zoom way out philosophically outside of all value systems of like this religion or this political structure, you just zoom way out to human functioning and the philosophical boundaries of relationships. Ethics is what causes harm and what promotes growth, and what is right would be things that reduce harm and promote growth, and things that are wrong would promote harm and decrease growth. And so you're looking at really broad guidelines, and that is what ethics is. So it's not within any particular narrow value system. It's this very broad perspective of what therapists should be doing and not doing. Let's talk about what therapists are supposed to do to keep you safe in therapy. What they swear to do, and what I've sworn to do to keep the professional license, is first of all to honor your autonomy. This is a very important principle and one that I am super passionate about. Autonomy is your right to choose. It's your voice. It's you navigating, choosing your goals, saying what your needs are, deciding where therapy goes, deciding what assignments you're comfortable taking, or if you like how the therapy is going. It is using your voice, and not only in the therapy session itself, but outside of the therapy session as you enact on those goals. Realizing it's not about the therapist's agenda, it's about your agenda. The therapy is about you obtaining the goals that you want and not the therapist imposing those goals. And not only that, you using methods that feel comfortable to you, that feel growth inducing, that feel positive to you, and not something that the therapist says, well, you just have to do it this way. So the autonomy would be your voice, your rights, your choice to decide how to navigate achieving those goals. I'm trying to think of a good example. Let's say, here's a good one. Let's say I have a teenage client who has been self-harming. And so we've had the conversation that, this is something mom needs to know about. She really needs to be aware to support you. And of course, that's a longer conversation. I'm making this short just for this video. If I respect this client's autonomy, I let them know that I think this is something mom should know. And I listen to their point of view. If they feel really scared, if they want to be the one to tell her, if they want me to be the one to tell her, or if they feel unsafe and unready. So if I didn't respect this teen's autonomy, I would just immediately tell mom. And now, of course, if it's at the level of suicide, that would be mom would know no matter what, right? But let's say it's, she's scratching herself with, a bobby pin or something. Then we have that conversation. This is my opinion. How do you think? What do you think? Do you think she needs to know? What are the risks with her knowing? What are the benefits of her knowing? What if you told her? What would that look like? What if I told her? What would that look like? And we just talk about that and collaborate it so that she feels like there's a sense of autonomy. I hope that example helps. I just kind of pulled it out of thin air. All right, the next principle that therapists operate on is beneficence. Beneficence means a therapist should be committed to working for your ultimate good. Their view should always be what is in the best interest of the client, instead of what's in the best interest of the therapist, or what's in the best interest of some other family member or some social structure. The client is the focus of the therapy of what is going to be beneficial for them. For instance, let's say I'm working with a 30-year-old client and her boyfriend is somebody that I used to know. And I know that this guy is a really nice guy and he's had women break up with him lots of times and he's really sad about that. Maybe I don't talk to him, maybe it's been years, but I know who he is. Obviously, I don't tell the client that. It's none of anybody's business and I don't make a thing out of it, but I'm just aware in the back of my mind. And I remember back in the day, I felt sorry for him because women always broke up with him. Well, let's say my client's saying, I really want to break up with this guy. All right, beneficence would say that I am focused on this client's ultimate good. So I listen to her and her thoughts on breaking up and what her hopes are for achieving with that and what some of her pain points have been. And I help her with that. And I don't even go there thinking about, oh my gosh, how's this going to affect this other guy, right? If I even think that thought, I kick it out of my mind and I just go, it's whatever. My goal is to help this client with her goals, right? So that's the client and their goals that has my attention. All right, the next therapy principle or ethics principle that we all as therapists swear to follow is that of non-maleficence, which means do no harm. And what that looks like is just an awareness that something I say could potentially cause trouble for this client. And I need to be very aware not to do that. If I gave them some bad advice, or I gave them some aggressively positive advice and they went and acted on that and it caused them a problem, I need to always be screening what I'm about to say. What are the risks and the benefits? If I tell them this and they go do it, what are the risks that it's going to go really, really bad versus good? If it looks like the risks for it going badly are pretty high, then I need to be super careful about that. I had a client who told me of a story of a previous therapist who had diagnosed her with a personality disorder, which I disagreed. I didn't think that was right. But this other therapist had told this client's husband that she had a personality disorder. And then the husband, who did have a personality disorder, started labeling her, and it really split the marriage up, So those are the kinds of things that we just have to be very aware of. We can't always prevent things that we don't foresee in our very best judgment. It's not that we can control everything and make it work perfect, but it does mean that if there's any way we can foresee that something we're going to say or do is going to cause serious harm, that we need to check ourselves at the door. So it's just a thought. There are no hard black and white answers on these things because ethics are challenging. There can be exceptions, there can be fuzzy gray areas, but it's something that we aim for, and you should know that that is what your therapist should be aiming for, is to not cause harm. And the last couple of principles I'll touch on is justice and trustworthiness. This is what we should be working on as therapists. We should be basing our treatment on justice and trustworthiness, meaning treating you fairly and maintaining strict confidentiality. So really respecting that relationship, obviously not breaking any kind of confidence. If anything that's said in these four walls should stay in these four walls, and you should know that. And so you can feel safe that, if I'm, or your therapist, or, is out with friends at dinner, that they're not laughing about some story you told. Like that should never, ever happen. Okay, I hope these are helpful for you in navigating with your therapist. Please grab that free download that gives you all the tips for how to be successful in therapy, and see the playlist to get all 6 episodes in my description, and I'll see you next time.